Good afternoon, everyone, and thank you for joining us today. Good morning to some of our colleagues out of Utah, and good evening to the colleagues in Berlin, in Germany. Thank you for joining us for the second part of our healthcare webinar series titled Succeed in Germany's Healthcare Market. Despite the date, April Fools, there are no April Fools jokes today. We will indeed have a healthcare-focused webinar for you today. I'm Omar Oweiss, Director of the Washington, D.C. office for Germany Trade Invest, and responsible for the healthcare industries for North America. Germany Trade Invest is the economic development agency for Germany. In a nutshell, we help international companies set up their operations successfully in Germany. We're an excellent resource to help you set foot and get your business up and running. As I said, today we're hosting the second part of the healthcare webinar series. We launched this webinar series back in December of 2013. With focus with an economic overview and introduction on the German healthcare industry, as you see here on this slide. We have three more confirmed for this year, focusing on BioRegions, growing your business in an aging society, so demographic challenges to the healthcare industry, as well as e-health and health IT later on this year. Please check out this slide and also our website here, which we have dedicated to our webinar series. Here you'll find information on current webinars, past webinars, and also links to future webinars for you to sign up. Today's focus will be on reimbursement in Germany, how it works and why it works. This topic is extremely timely and relevant if we think about the major healthcare overhaul taking place in the United States at the moment. Regardless of where one stands on the controversial Affordable Care Act, or Obamacare, as it's more widely known, the fact of the matter is that money needs to flow properly, and there are a lot of players in the healthcare scene, ranging from patients to providers, manufacturers, to insurance companies. This is, of course, true both in the U.S. and in Germany. We have four distinguished speakers lined up for you today: Ms. Shelby Peterson and Ms. Anette Salama from the United States Commercial Service, Mr. Olaf Winkler from BVMed, as well as Mr. Gabriel Fleming from Germany Trade Invest. You can ask questions at any time throughout this webinar using your GoToWebinar message or chat feature. These questions will be collected and answered during our Q&A session following the presentations. Our first presenters, as you see here, are both from the United States Commercial Service. The USCS is another excellent resource for U.S. companies looking to expand their business portfolio internationally. Shelby Peterson has been with the Department of Commerce for 7 years. Currently, she counsels Utah-based companies at the Salt Lake City Export Assistance Center. Prior to that, she served as a project officer for the International Buyer Program in Washington, D.C. There, Shelby coordinated embassy and consulate-organized buying delegations for over 25 domestic trade shows. Shelby will be highlighting the services portfolio of the USCS and explain how you can take advantage of this excellent resource as well. She'll be followed by Anette Salama, who's been with the U.S. Commercial Service since 1983 and joined the U.S. Consulate in Düsseldorf in the mid-90s. Shortly thereafter, Anette took over the medical portfolio and has become the spokeswoman for Commerce's CEO program at the world's largest annual medical trade show, Medica in Düsseldorf. Anette will address why U.S. companies should strongly consider the German market and how Medtech Made in USA can be successful in Germany. Sorry about that. I will hand over to Shelby first, our next presenter.
Thank you, Omar. Thank you, everyone. As Omar mentioned, my name is Shelby Peterson. I work in the Utah Export Assistance Center. I just want to go over with you a little bit about the Commercial Service if you've not heard of us. We are a very unique agency as part of the U.S. government, and we're here to help you. We're here to open up the world for your business. We have offices all over the United States. As Omar mentioned, I'm based in Salt Lake City, Utah. We also have offices in embassies and consulates in nearly 80 countries. We're part of the U.S. Department of Commerce International Trade Administration, which falls under the U.S. Department of Commerce. Our mission is actually very simple. We're here to help you, as a U.S. company, export your goods and services all over the world. Our focus is on small and medium-sized businesses, but we are open to helping everyone, as long as you're, in most cases, U.S. content is 51% or greater. In addition to that, we also help with U.S. economic interests internationally. So if you run into an advocacy case or a commercial diplomacy issue in getting your products overseas, our specialists are able, our global specialists are also able to assist with that. And then probably our third and most important role as the commercial service is to help U.S. exporters find qualified international partners. We want to find folks for you to do business with that are safe, and then that also will help expand and promote your business overseas in the way you would like it to be. So many of you, since you're already on this call, probably do sell globally, and you realize the importance both for you and your company in doing so. These are just some reasons that a lot of companies do like to go global, or just just different reasons to do so. Obviously, market growth, economies of scale, the ability to extend your product life cycle, moderate seasonal production cycles, faster growth and higher profits, competition, and really, at the end of the day, it's because we enjoy what we do, and we want you to enjoy what you do as well. So these are, next we just want to go over some of the opportunities that the U.S. Foreign Commercial Service can offer to you as a small to medium-sized company or a large company that is looking to expand overseas. There are offices all over the country, like I mentioned, as I'm based in Salt Lake, that assist domestic companies with trade counseling. So you can go into your local office and just sit down with a trade specialist in your industry. He or she will walk you through some opportunities. There's some research that's available to you. Will help you determine the markets that might be best, the best entry for you, and just give you some advice, basically, if you need it. We can also provide some market intelligence, which would be anything from our online statistical resources to recommending you to speak with our specialists overseas. In doing so, we work with a lot of programs in terms of business matchmaking, which is, as I mentioned earlier, the opportunity to connect you to the right partners overseas. We have several programs that are very popular among our U.S. companies in helping to accomplish this. One would be the Gold Key Matchmaking Service, which is an opportunity for U.S. companies to share information about their company with our commercial specialists overseas, such as Anette, who will be speaking in a minute. And our specialists overseas will work with that company to find a list, an appropriate group of international buyers that would be interested in the product. The U.S. company will then be responsible for making travel arrangements overseas, and our specialists in country will make the introductions and escort you to the meetings and make sure that those opportunities with one-on-one buyer meetings are appropriate and also beneficial to you. We also do international partner search, which is similar to the Gold Key in that it's actually, you don't actually have to go overseas and meet with the partners that our commercial staff has found for you. You're just given a list and you can reach out to them directly. We do a multitude of different combinations of these services, and we also have the opportunity for you and our specialists and your staff or your specialists in state to help come up with a good plan for you that would be most beneficial for your company in a particular market as well. And as I mentioned earlier, commercial diplomacy and advocacy are also a big part of what we do for U.S. companies in helping to ensure that their products get out overseas and that you don't run into any issues as you are exporting. Resources available specifically to healthcare companies. The U.S. Commercial Service has a specific healthcare team that has put together a healthcare resource guide. This link is here, and I can speak to Omar about getting this out to everyone so you don't have to write it down as we're going over this. The healthcare resource guide goes through each country where we have a post, an office, and an embassy and consulate, and goes through an overview of the healthcare market, and then things you should know about the market, top niche sectors that are available there or that are in need there, and then a contact person. The Country Commercial Guide Market Research Library is a great resource where you can find specialized market research that's actually been compiled by our specialists overseas. There's also an opportunity for trade shows and business-to-business opportunities at those trade shows that can be available, or that is available on the Healthcare Service website as well. And then just the overall healthcare service or the healthcare team link is the last hyperlink there, and you can find all of this information, including regulations and certifications you may need for products and services, and trade shows and any kind of other contact information that you would need. So you are, if you are looking for your trade specialist, if you have not worked with your home trade specialist in your local state, you can go to export.gov/US offices and find who that person is, or you can email me and I'd be happy to make a virtual introduction for you. So with that, I'm going to hand this over to Anette, who will go over a little bit more about the German healthcare market. And here you go, Anette.
Okay. Thanks very much, Shelby. Good morning and good afternoon, everybody. And thanks, Shelby, and thanks, Omar, for your kind introduction. I'm very happy today to be on the panel with Germany Trade and Invest and the German Medical Technology Association and my colleague Shelby, who is our team lead for medical devices for our global healthcare team. Any of the stateside and country members of our team can be tracked via our homepage, export.gov/locations/domestic or /international. Medtech Made in USA, Successful in Germany, the title of today's webinar. This is not seemingly contradictory. In fact, there are thousands of US products on the market already. The fact remains that Germany is a hard nut to crack, the largest in Europe, but also the most complex, fragmented, conservative market there is. Therefore, if you can make it here, you can make it anywhere. Just a couple of anecdotal experiences to follow and a couple of slides in a public-private partnership mode from my German consultant friend Ulrich, a physician who has advised numerous firms on market entry in Germany. Since you today have two government agencies, US and German, and a trade association presented to complement, I thought it useful just to include a couple of slides as a perspective from a private sector partner. Why doesn't it work? Come on. Okay, well, hold on. There you go. Okay, some examples of Medtech USA successful in Germany. Top left, Cincinnati Sub-Zero's patient temperature management system. Cincinnati has successfully established distribution in Germany and Europe with sales representatives selling direct to end users. One of its competitors, Horizon out of Minnesota, hired a country representative to develop the German market and was then taken over by a large US medical firm. That's also a strategy. In the middle, you see Contour Product CPAP Pillow, which is now successfully distributed throughout Germany via a major German distributor, regional dealers, and online medical shops. Top left is Christie Medical's Vein Viewer, successfully introduced into Germany and beyond via our CO program and by another private sector partner of ours. Bottom left, you see Eastem electrodes manufactured by Pepin, also a CO program participant who found distributors in Germany and beyond through Commerce's CO program at Medica, the new step trainer for rehab clinics for which the company's international sales director successfully found a small German distributor serving as the sales rep and also selling direct and via catalog. And finally, Ohio-based YSI's biochemistry analyzer for sample testing, where the German distributor who needed additional product tracked the US firm and concluded a distribution agreement. In conclusion, lots of different gateways into the German market. How do I go back? Okay, sorry. I've gone a bit far. There you go. This Why Germany slide lists the pros for Germany. Large, affluent, open to innovative products, well-educated and productive workforce, a safe legal framework and IPR regulations, 9 neighboring markets and prime transportation, logistics, highest levels of R&D, universities and industry clusters. And last but not least, a host of trade shows in different segments, whether it's home care, orthopedics, rehabilitation, personalized medicine, lab products. Be sure that Germany has a trade show for each, and a good one too. Then why do some exporters fail? Well, there are just a few challenges that you have to remember. Germany is not an extension of the US market. An illustration of this is the request, can you please find me a distributor for Europe? Or the rather comprehensive distributor questionnaire, which some US companies tend to send out with initial communications. It asks for annual sales, customer database, shareholders and partners, outside contacts, information which a German CEO would regard as rather confidential and would not provide freely in a first or second conversation. Germans tend not to be that outgoing and communicative. They are rather conservative, a little bit reserved, sometimes even perceived as arrogant. Yes, they do have some good medical products too. And some of them have had bad experiences with some US suppliers, companies that did not deliver after initial negotiations, or companies that, after having the German partner develop the market, took over the end-user database and sold product via internet for half the price. Also, the German market has seen a decline in good mid-sized distributors, since a lot have been purchased by the industry giants, GE, Siemens, Philips, Donjoy. Companies like mid-sized distributors like Idel or Ormed are long gone. You may want to consider the same avenue, purchasing a supplier in your particular niche market. Zoll Medical is doing that, and many others. It may be a good opportunity for companies with the necessary financial resource for quick and easy market access. A great resource in this respect is the website of a private partner called Schillinger. They're a healthcare consultancy with its own database of distributors worldwide, a job portal, and customized merger acquisition searches. The remaining large distributors can pick and choose and sometimes have such a large number of products in their portfolio that it is easy to get lost amongst them. Therefore, a more regional, from small to large approach is worth looking into. And a regional dealer with a solid customer base or sales rep who has previously worked for one of the large manufacturers in Germany, whether it's GE, Stryker, Boston Scientific, Abbott, or other, could be useful. And check out, or let us check out whether a competitive product is on the market already and what the pricing is. Patience is also needed, with an average of 2 years to get a product into the market and of 5 to 7 years sometimes average to make a product succeed in the market. So here are a few slides on the German healthcare market and its challenges from my good friend Oweiss. The German healthcare market is highly regulated. You see the reimbursement market is very large, 90%, the private payer market, the suppliers. The reimbursement market is estimated at 231 billion US dollars annually, with the inpatient and the outpatient market, and a typical market entry in the inpatient, the hospital market. This is the private payer market, which is gradually increasing, but still rather small. And this is important for suppliers to, with regard to your competition, products are sold or reimbursed at high price, but components and parts are increasingly purchased in Asia. And the quality in Germany still has to be certified and assured. Here you have an overview of the healthcare providers that benefit from reimbursement from the sickness funds. And this is the market entry strategy. Define your strategy, make a market analysis, contact the right people, and negotiate with them the right topics, and then go to market. So it all depends on you. Do you know the regulations? Are you open to different sales channels, validate information you receive from different sources? When it comes to disputes, can you resolve them to your benefit and by keeping your market? Because we've also seen companies lose their market in a trade dispute. Are you visible, credible, supportive, and willing to invest time and money? Then the market is yours. A last word on Medica, the world's largest annual medical technology show here in Düsseldorf. A, be prepared when you exhibit or attend, because you can easily get lost in this humongous show with 136,000 visitors and over 4,600 exhibitors. So be prepared, consider your options early enough before March in the year, which includes our highly valuable executive program on the show floor, which is called the CEO Center. And you see the unique advantages described here in the summary. And B, book your accommodations, since rooms are really hard to get for Medica. Exhibitors book a year in advance. And by the way, for Medica 2015, we were just informed that the days would change to Monday through Thursday. So the 2015 dates will be November 16 to 19, giving you more floor time from Monday to Thursday with professional buyers and distributors. This is what you get as happy trade show customers and often commerce clients using our global healthcare team network, deals and happy faces. If you are seeking funding support for trade show participation, please access grants.gov or SBA.gov or contact your local state's trade development staff or our U.S. Export Assistance Centers or Shelby, who will help you to get a personal contact. So where do you find us? Okay, this is my friend Ulrich, so you can find him. And this is me. Thank you for your attention. And back to you, Omar. Thank you very much.
Thank you, Anette. Thank you, Shelby. Two great presentations. Thank you very much, ladies.
Yes, I hope now I'm still online. Do you hear me?
I believe you are.
Yes?
Yes, hear you, Olaf.
Okay.
Just want to quickly present our next speaker, Mr. Olaf Winkler, the health system expert of BVMed, which is the German Medical Technology Association. It represents about 220 manufacturers and service providers of medical devices with presences in Germany. Mr. Winkler helps individual companies with support needs regarding reimbursement and holds a series of training courses for medical device company managers in need of updates on the current reimbursement regime. Mr. Winkler will present the newest trends in the German reimbursement system. Mr. Winkler, I hand the podium over to you.
Okay, I hope you see my slides now. Yeah, good morning and good afternoon from me from Berlin to worldwide. I hope you see now my slides. Okay, my job is now in the next minutes to give you an overview about the current development in reimbursement for medical, especially medical device in the German domestic market. That's my major job. I have a lot of member companies, and not only member companies, companies who are interested in the German market to show them the pathways how to get the real reimbursement and the second to sell the products to the hospitals and doctors. Okay, I give you another special overview about the current inpatient payment system, which is called the German DRG system. Then I give you an overview about the innovation clause, which is called NUB, and the latest news about the regulation that is a little bit coverage with evidence development in Germany named Erprobungsregelung. I show you the latest development in this scenario. Okay, before you want to succeed in the German market, you must answer this question to you, your innovation strategy. You can be successful with your product in the German market when your medical device or procedure has comparing of existing methods or competition methods in the need that it's reached with the same cost or it's reached with a lower cost, or the need of growth is bigger than the costs grow. So innovation is then successful when you have medical and economical needs. How to show this benefits, I will show you in the next slides. what are the biggest innovation hurdles actually in Germany? We have an increasingly no longer sufficient remuneration, like in the German DRG system. We have more and more stronger trial regulation. And what is coming up in the next scenario, but we don't know about, is the draft of the European regulation for medical devices, especially for the CE marking. Okay. I give you first an overview about the different settings for the funding overview, and we have three big markets. First, the biggest market, the inpatient scenario. All Germans which are going to a hospital are paid by the German DRG system. Equally, are they insured by a statutory health insurance or a private insurance? In Germany, 100% of the people are insured. The second market is the outpatient market, and they are funded under a special catalog. It's called the EBM catalog for the statutory health insurances. And last but not least, the growing home care market, where you can use medical aids and other things, contains medical devices, which is used in the home care scenario. And for these three different markets, you have different regulations for reimbursement. So what you must prove is, before you go in the German markets, you must prove by yourself in which market you will sell your product, and then you can answer which reimbursement scenario is important for you. Okay, let's start it in the inpatient market. 2/3 of the money the medical device suppliers make in Germany are make in the inpatient market. You know it by your products, and a lot of big American and US-based companies are very successful here in the German market, and they are leading markets. Okay, we have since now 10 years the German DRG system, and the system is generally mandatory for all hospitals. And this DRG system is a system which is leaded by diagnostic codes, which name is included, and procedure codes. It's very important for you because the procedure codes contain the specific medical devices. But we have no procedure codes for brands, but we have a generic procedure code in the German DRG system. And this reimbursement system is based on historical cost data, and it is updated every year by the Institute for Calculation of the DRG, which is named by INEC. That's the Institute for Hospital Remuneration System. You can find the actually DRG list on the website of this institute. Use only Google and find it. Okay, how funding now is the funding with the inpatient care system? There is no need actually for clinical evidence for your medical device. What you need is a CE mark. The CE mark allows you the free selling the medical device in German hospitals. So there's no formal evaluation of evidence in the process of changing or updating the DRG system. What you must prove is that your technology or medical device is covered up by this procedure codes. For new novel technologies you want to introduce in the German inpatient market, the German DRG system has a special regulation which is called NUB, and that is designed to fund new methods in the German inpatient setting for the next years or for the actually years. The new approval required a certain application, and every single hospital which wants to use this NUB code must be submitted by the INEC. So if you want to sell a medical device in all 2,000 hospitals, so every single hospital must to apply for this NUP, but it's no problem that it can be made by online tools. And but it's only the first step to get money. When the INEC published the list of the new NUPs, that is published normally at the end of January, and they showed your new technology is proved by a NUP or not proved. But the second point is then that the single hospital must negotiate an additional amount for the certain methods with a single, with a statutory health insurance, and our data show us that only 30 or 40% are successful in this part. This slide show you the way where you can prove if you need a new OPS code or you can make an NUB. But don't forget, not a company can submit for NUB. It must be done by a single hospital. Yes, the good message is that you need no special improvement of the question of evidence, but the problem is that the sickness funds ask for the study data or data about the evidence of the new technology, and they can build up some hurdles to don't pay for the new technology. Yeah, you see the system you have found get paid normal DRG money for actually technology, and when you want to apply for a NUP, you get additional money for a NUP, and it can be if you have a new technology this is not accepted or installed in the DRG system, you need a NUP additionally. You can find the list of the DRGs by the INEC and where all the technology are described. Okay, that's the good message. The good message, go back to the last slide, is that new technology have the free entrance in the German reimbursement system, and if your new technology is not more costly than the comparable technologies, you have no problems to sell it. For new technologies which are high on the price, normally you must prove to submit a NUB for the hospitals. Okay, then on 2012 we have a new legislation framework which is introduced in 2012, but still running first on last year. What is the sense of this new legislation framework to prove new technologies? The Joint Federal Committee or the Gemeinsame Bundesausschuss in Germany have now the possibility to prove new technologies if they show the evidence of their benefits. The good message is that especially a manufacturer can now apply for using this CED framework. He can apply for a CED improvement. The good message for is when they will be accepted from the GFC, then there are accepted that you must find a study, and in this study the patient treatment will be paid by the sickness funds, but the cost for the studies must be paid by the manufacturers. Yes, you see an overview about introduce new medical devices in the German market. We have the risk classification, and you see that only class 2 and class 3 technologies like implants or cardiac devices or something else are the lower number of total introducing new technology. The biggest size are class 1 products like beds or wheelchairs or something else. Okay, the evaluation methods about the GFC is totally different. If you want to introduce a new technology or new methods in the inpatient sector, you don't need an allowance. if you want to sell your product in the outpatient market by the physician, you need a special allowance by the JFC. So the most innovations are introduced in the German, in the inpatient scenario, because you need no allowance, a special allowance. Okay, and the new CED regulation show that your technology must not show the evidence of the benefits. You must show the potential of evidence. That is a lower step before the evidence, because you have no, for example, you have no RCT data or something, or study data. You have only your data from the CE mark. So, but when there's a potential, you can apply for this CED by the JFC, and then there will be established a study where to find out about the medical evidence. Yes, the access to the trial regulation can be only conducted by the JFC, and the good message is that the manufacturer can apply directly to the JFC. This is especially interesting, this tool, for companies which want to sell their products in the outpatient market, because in the inpatient market it makes no sense, because you need no allowance from the JFC. The recommendation deadline actually is the end of April, because the JFC proved normally 4 or 3 months to prove your submission, and then on the end of September the JFC decided which technology can used by a CAD study in the next following year. Okay, I show you, I repeated, you have only 3 months, then you get an answer from the JFC when you apply for a CAD. Then they prove the potential for an additional need, and then you must be accepted that the cost for the study will be paid partly by the manufacturer. And the content of the dossiers included some information about the medical device methodology, information, and essential facts, etc. The cost of the study must be paid by the manufacturer. It can be that when you are small companies, that the costs can be reduced by a maximum of 50 or 70%. Yes, you see it when you have a less number of employers, or your turnover is lower, than you see it here on the slide, the money, then the cost can be reduced by the JFC. But the final question is, what is the experience of the new CED regulation? We have no experience, because in this month, in April, it's the first month which the JFC published the list of therapies which can used by the CED program, and we have no experience about this. We think it's a cost risk of the companies, and it can be a problem by the competition thing, because there exists no patent protection for the technology. And last but not least, the thing about the time running when they will start the CED. The JFC estimated it's nearby 29 months. It's a long time for medical device company, and without the study time. And the problem is that the JFC have not enough money for spending for the CED. Okay, that was for me, and if you have some question, I'm waiting for your question. Thank you. Go back.
Thank you very much, Olaf Winkler. Another fascinating, very informative presentation. As Mr. Winkler also said, yes, if you have questions, feel free to ask them using your chat and message feature. We've already had a couple of questions come in, so please keep them coming. We have one more presenter, Mr. Gabriel Fleming, who's been working for GTAI. Olaf, can you hand over the screen to me, please?
Yes, what must I do?
Just change presenter back to me, please.
Back to me. Is this correct?
Not yet. top right, there's a blue button, Change Presenter. Oh, I think you're doing it.
Yes, okay. Okay.
I think you're still... Bear with us 1 second, please. All right, I will go ahead and let me see. Dismiss. All right, I think I got it. Oops. And all right. I believe you should see my screen now. All right, our final speaker, Mr. Gabriel Fleming, who's been working for Germany Trade and Invest for over 4 years, always focused and dedicated to the healthcare team. During his tenure, Gabriel has worked with numerous international medical device, pharma, and biotech companies in helping them access and expand into the German market. Today, Gabriel will give you a detailed overview of the GTAI service portfolio and how we can assist international companies in setting up operations in Germany. Gabriel, I will hand it over to you.
Here I am. Hello, Omar, everybody. Thank you very much for handing over the baton here for me. I pressed the right buttons. Here I go with my presentation on our service portfolio that we have to offer for U.S. companies, but basically any international company looking at the German market and preparing to become established over here by any functions, including sales, manufacturing, or R&D, or all the three of them together. My intention here, frankly, is to really overwhelm you a little bit. And here we go. This is our service portfolio that we have to offer. In my presentation, I'm going to try and break it down step by step to really show what we can do, depending on which stage your individual company is in. We will see some logos of companies that we've been working for. Please do not understand that any information can be linked to these companies directly. I'm spending some care to prove that we're working confidentially here. But the testimonials I will be referring to will be great to understand exactly what we have to do. So no matter what, in which phase your company is in strategy, already taking first steps, or being at the funding stage, we have the right tools prepared for you here. We are a staff of 60 in Berlin. Actually, I'm just 2 or 3 miles away from Mr. Olaf Winkler here. He would be one of the experts that we can always get in touch with to clarify very individual questions for you guys. So this is the 5 core services that we have to offer. First one, in the first stage, we would support your strategizing business. And of course, it will go all the way down, including tax and legal information, financing functions, partnering support, and down to site selection, which is, in fact, for many companies, the last decision to make when they expand into Germany. But sometimes we work with companies that already know where they want to go. So not necessarily we will go through the order of the 5 steps here with everybody, every company. We try and design our services just as they might be needed. Once you have chosen a location and you set up your GmbH and you're set to go, you will have ongoing support by our state agencies. Whoops, here we go, I'm sorry. I was just kicked out by the program. We have our state regional economic development agencies prepared to be integrated in any preparatory or ongoing services. And also, of course, regional clusters would be very interested in having you guys as their members. For instance, if you decide to set up shop in Tuttlingen, which would be a very classic hotspot of medical technology in Germany, then Medical Mountains, the local cluster, would be happy to keep you growing. Okay, so first step, strategizing. What can we do for you guys? Typically, we'll start out with market insights and giving numbers on current segment volumes, growth rates, etc. But also, of course, we would give you a picture of the current regulatory and reimbursement situation. We have all sorts of publications prepared, and I'm thinking here of a great success story we had last year with a U.S. surgery and implants company starting direct sales in Germany. What we did with them was quickly explore the CE mark situation and how to approach the notified bodies like TÜV Süd, DEKRA, and other companies that will certify the products, as Mr. Olaf Winkler said, is the first step into the German market. Next step was to check and verify if there is current DRGs in place and that German hospitals are actually able to become reimbursed by the health insurances for the expenses they have on the product. In that case, yes, we made sure, lucky you, there's already DRG codes in place. You don't have to apply for an innovation status, etc. So it's a mere administrative procedure. After that, we checked in the InEC browser database that Mr. Winkler also already mentioned. It's a national database of the health insurance companies, which actually contains transparent and complete data on all operations and procedures that are performed in German hospitals. So depending on what your ICD code is and diagnose related, you will find all numbers of your product opportunity in the market, if you will. This is the exact market volume that you can find out by checking in the InEC browser. And as that is a little tricky, that we can be of help in that part. Okay, the guy at the company I worked with was really happy when in the end we organized a series of meetings with clinic directors and surgeons throughout the country, and he was able to discuss very openly with them, very surprisingly open, what they thought of his products, what their current standards are, and what they think he should do in order to get his product running. Okay, second one, tax and legal issues. Together with our dedicated P&L team, as we say here, we can tackle practically any tax and legal issue, including easy ones like visa regulation, Social Security, and so forth. An especially nice case study or case we had here last year was a diagnostics company starting sales and services functions in Germany. They started out by digesting our publications again, and we were able to then tackle any open questions that they did have. And they were quite surprised to find out and learn about regional differences that we have in German corporate income tax. So if you go and look at Munich's situation, then of course there you will find the highest concentration of industry and successful companies in many sectors. So maybe the tax situation will be different than if you go into the rural countryside, and you will find other opportunities there. So the company quickly learned that it will be a decision influencer for them, and in the end they did find a very attractive spot very close to Munich. The issue of work permits was not a big issue in this case, as German and US governments work together closely. Another big one, though, was a very personal one, actually, was the vicinity of an international school to the prospective a subsidiary and branch office, as the company was going to send some expats, and they of course wanted to have their kids nearby in international school where they can continue speaking English and so forth. Very interestingly, we found a school in time that that actually was free of charge because it's a public school. So they were quite amazed that we really found some good solutions for them. The last decision was for a legal entity, and that actually was not a big issue either, as they went for the classic GmbH. Okay, get your project funded. Funding, of course, is a big issue in many cases, and we have plenty instruments here in Germany that we can actually explore here, also with the support of our funding team. Another great story from the recent past, I worked with a great dental company that was preparing to set up a test clinic and a manufacturing site nearby. How did you go with them? They had pretty good understanding in the beginning of the funding situation from our overviews, but we really had to bring them together with our colleagues from the state development agencies, who were able to discuss their individual programs that would make sense in their individual settings. So in addition to the overview of the entire instruments, we had personal discussions to find out the real individual options. Okay. With that, they were very well prepared for talks and negotiations regarding loans, but also government grants that, in the best case, they are non-repayable. So it's money that you can keep. It's a government initiative designed to take the burden out of building up manufacturing facilities. And actually, as soon as they had then started their operations and legal entity, they did receive funding, and I think it was quite significant funding, actually. Okay, partnering. This is a critical need for many companies entering any foreign market, but also in the German market sometimes. Fortunately, we here are prepared to find the right partners regarding manufacturing and or R&D. A success story here would be a medical aids company that, also from the US, belonged to an international group, but when they approached us, they had just gotten clearance to operate individually by themselves in Germany and the European market, which also meant they didn't know much about the market yet. So our job first was to provide market insight, but then especially to identify any potential partners for manufacturing and contract manufacturing modus, or also in a strategic mode working with a German company. So we did approach some companies and cluster representatives. We put together a long list, also by searching in databases regarding or corresponding to the briefing that we had. And the company then boiled down the short list. We established a series of meetings for them. I think it was in Hamburg and Cologne and Frankfurt, that they did meet with a number of prospective companies, prospective partners, and I think actually it did work out, and they lived happily ever after. Site selection. This is, of course, the most classic service that we would offer for expanding companies. As I said before, some already have a preference. They might have partners in Cologne or in Munich or some other place. Others will go the entire process of searching and selecting and visiting sites, and we are prepared to help in those stages. So let me get to the point. Here we had a tour through half of the country, Berlin, Heidelberg, Frankfurt, and Munich, and actually then visited 2 sites in every city, every point of the tour, which was a good overview for the company. In the end, they decided to go in one specific region, which I'm not going to mention here, but they did find the right real estate for a regional headquarters. 100 employees could be housed, and they were good to go. So our last thing was then to hook them up with, whoops, sorry, I forgot that one, to hook them up with recruitment agencies, and they were good to go. So with that, thank you very much. I really hope to see some of you here in Germany. And with that, I'm going to hand it over to Omar. Thank you very much.
Thank you, Gabriel. Bye-bye. That concludes our presentation part. Again, we have question and answer period coming up now. Just a quick reminder, all the presentations and the entire webinar has been recorded, and all the presentations will be posted on our website. So feel free to keep an eye on that as well. Have a couple of questions here already that we received. Let me see, where's the first one here? What is the best resource? Again, this is an open forum to all the panelists, to all the presenters. What is the best resource to competitors in the antimicrobial advanced wound care dressing in the German market, plus market share? Would anyone like to take a stab at that?
That was a tough one. Could you repeat that?
Sure. What is the best resource to competitors in the antimicrobial advanced wound care dressing in the German market, plus market share?
Interesting.
Again,
okay, from my side, I'm just going to have to regard that as homework, and we'll gladly get back to that.
Thank you for that question. We will definitely get back to you. Another one here. Can you elaborate on the adoption of healthcare technologies such as EHR systems in German hospitals and technologies to support those types of systems, such as point-of-care mobile computing systems? I know that Siemens is a huge player in the market, but are there opportunities for smaller companies to come in and compete with medical equipment to augment those systems, even if the hospital already has the equipment from another vendor? That was another question. Another very specific one.
Yes.
This is for Mr. Winkler regarding...
Yes, this is a question of, so I understand it's IT services, and IT services, the DRG system covered up to get money from the insurances by procedures, and all capital goods like software tools and something else is a job directly to the hospitals, and you must show them the way. And if there's a good solution for the hospital, then they have to change it. It's a question of competition.
Again, any other questions? If you go, I'm sorry, go ahead.
For a second, Omar,
Sure,
this
sure.
is Anette from Düsseldorf.
Yep.
The e-health market is occupied by a number of large players, but there are a good number of mid-sized companies also. So my best recommendation would be check out the competition for your particular software or e-health technology, and then find a suitable German partner, because it will be difficult to access that market on your own. Thank you.
Thank you,
Yeah,
Anette.
and in fact, speaking for Berlin here, we in fact have a specialist focusing on IT, e-health, and mobile telemedicine solutions, so we can get back to that very dedicated way.
Correct. And we actually have a webinar coming up at the end of the year on e-health and health IT. So great question. Thank you very much. Another one here. I'm not sure if I understand what triggers a need for CED. Is it based on risk or classification?
Yeah, that's not triggered on classification. It's triggered here, Olaf Winkler from BVMed. It's triggered on the risk. It's very simple.
Wonderful, thank you. I have another question here. Are license and registration needed to sell in Germany?
Olaf Winkler, BVMed. That's a good message. You don't, when you want to sell a medical device in Germany, you need only your CE mark and no other registration. You can free sell your product in hospitals on the outpatient scenario. The only thing is, what I said is when you want to sell medical devices in the hospital market, don't forget we have a lot of GPOs, and it can be that you must list it on this for the GPO lists.
Thank you very much. Another question here. Interested in hearing major trends and when reimbursement on colposcopes will occur.
Okay, Olaf Winkler, BVMed. Yeah, I give only that's the definition that this technology is a capital good, and the capital good is not paid by the insurance. It's paid directly by the hospitals or the doctors.
Have another question here. What is the process to get NUB regarding partners? Do we have to get hospital clinics on board as references?
Sure. Only the hospitals can apply for the NUB codes, and it's normally that the manufacturer help the hospitals to apply, and it's a very good idea to have reference hospitals.
I think we are very close to the end of time here. We'll take one more question here. What is the best resource to find competitors along with market share by product category? Is it okay to research and respond later? Oh, it is okay to research and respond later. And I think, yeah, we may have to do that. Perhaps something for Gabriel. What is the best resource to find the competitors along with the market share by a product category?
Interesting. Yeah, this would be personal interviews with medical staff at hospitals, experts from clusters dedicated to the line of business that you're looking at, and so forth. And of course, there are several market studies out there where you can find success or reference to successful companies. So this is something that we can wrap up and send in an answer mode via email to anybody who asks something like that.
Great. Okay. Well, you know what? At this point, we are out of time. I do want to thank all our presenters, United States Commercial Service, BVMed, and of course, Germany Trade Invest. Here again is my contact information. If you have any questions, please feel free to contact me at any time. You should have also seen all the contact information from our presenters. Presentations will be available on our website. Webinar has been recorded. Thank you so much to the presenters. You guys did an excellent job, and I wish the Berliners and the Germans a wonderful evening and a wonderful rest of the day to the American presenters. Thank you, guys.